Hello, my name is Dr. Deirdre Mulholland and I'm the Head of Standards and Methodology with HIQA, the Health Information and Quality Authority. I'm going to spend a few moments talking about the new national standards for safer, better healthcare, what they are, why they're so important, who they are aimed at and how you can find out more about them. In Ireland, as in many countries, we have identified the need to drive improvements in the quality and safety of our healthcare services. This is so that high quality, reliable and safe care can be provided for everyone who needs it. This care should be delivered in the most effective, efficient and accessible way within the resources available. And, like most countries, Ireland has many examples of excellent healthcare services, but we also know that patients have experienced being let down by serious failures. So it's important for us all to think about how to make improvements and to increase the reliability of our health services. Setting standards is an important step towards doing that. You, as a member of the public, should know what you can expect from healthcare services, just as those providing care should know what is expected of them. These national standards aim to drive improvement for you by first creating a common understanding of what makes a good, safe health service. They outline wide-ranging principles that we believe should apply across the full range of healthcare settings, such as in primary care and in the community as well as in hospitals, with the aim of achieving safer, better and more reliable care for everyone. Our vision is that these standards will create a sound long-term basis for improving our health services. They will do this by identifying strengths as well as highlighting areas for improvement. The national standards are organised into 8 key themes, and they range from person-centred care to good leadership and use of information. These standards encourage up-to-date, effective and consistent healthcare practice, and in so doing, they enable providers to be accountable for the quality, safety and value of the service they deliver. Large institutions and individual practitioners alike will be able to use the standards to improve their service to their patients. The person who uses our health services, you, the service user, is at the heart of these standards. It is important that you are treated with respect and given enough information to make decisions about your care. You should also be supported to take responsibility for improving your own health and well-being. To enable this, the standards expect service providers to put people's needs and preferences at the centre of care. We at HIQA believe strongly that healthcare staff only go to work to do a good job, and so the standards will allow frontline staff to find ways to show how well they are doing and not just identify problems. The standards also require providers to support their healthcare professionals in keeping up to date with developments in clinical practice and in implementing agreed national clinical guidelines. But modern healthcare is not only about what happens on wards, in operating theatres or clinics. Good planning, service design and oversight is vital to ensure services meet the needs of the people who use them. So the standards set expectations in these areas too. In HIQA, we have found, like our counterparts internationally, that leadership makes a crucial difference to how good and how safe healthcare is. Unfortunately, it is true to say that in healthcare, some people may find themselves working within a system that does not support them to do the right thing. So the standards also recognise that clear accountability, responsibility at every level and effective management is paramount for safer, better care. These standards have been approved by the Board of HIQA and by the Minister for Health. Given that the national standards are new to the healthcare system in Ireland, we will undertake an awareness and education campaign about them shortly. Service providers will be expected to carry out self-assessments of where they are in relation to compliance with these standards, and then introduce comprehensive action plans to address any gaps identified. In due course, we will check to see how they're getting on with implementing them. These national standards aim to give a shared voice to the expectations of the public, you, the service user and healthcare providers. They provide a roadmap for making safer, better healthcare a reality in Ireland, and we hope that these standards will lead to far-reaching improvements in healthcare of all kinds for many years to come. To find out more about these standards, go to hiqa.ie. You can download the full standards or a short summary of them, or you can listen to an audio version on iTunes. Thank you.